Madam President, I ask unanimous consent that the quorum call be dispensed with.
Without objection.
Madam President, the question of the week is more important than apologizing. Will President Obama live up to his promise that Americans can keep the care that they have and like? Democrats are clearly running away from embracing this law and are suggesting the President live up to his promise as well. Former President Clinton said just recently, yesterday, publicly that, and I quote, "I personally believe if it takes a change to the law, the President should honor the commitment the federal government made to those people and let them keep what they got." End quote. That's from former President Clinton yesterday in an interview that he did. So more and more we see people on the Democrat side of the aisle, Madam President, coming forward and acknowledging what many of us have been acknowledging for a long time, and that is that this thing is not living up to expectations. We need a timeout. It's clearly not working, and it's not ready for prime time, and it's obvious that we need to acknowledge that and come up with a plan B. Senator Durbin, here in the United States Senate, said in an interview Tuesday that cancellations people might face of their coverage under Obamacare and the statement that individuals could keep their plans, and I quote, should have been clarified, end quote. Democrat Representative Kurt Schrader from Oregon thinks the President was misleading the American public, and he said, and I quote, "I think the President was grossly misleading to the American public," end quote. Senator Feinstein, who's not up for re-election, is supporting legislation that would require insurance plans to continue to allow individuals to maintain enrollment in the plans that they like. Madam President, these mistruths are clearly affecting the President's credibility. President Obama's approval ratings have dipped to a record low, and another poll that was just released, a poll from Quinnipiac University, shows that respondents disapprove of the President's job performance by a 54-39 margin. His approval rating of 39% is worse than his previous all-time low of 41% in a Quinnipiac survey done previously. Further, most people, 52%, say that the President is not honest and trustworthy. We are on the verge of another misstatement from this administration where they make promises to the American people that they do not meet. Last month, the administration promised that they would have healthcare.com fixed by the end of November. It appears unlikely, according to today's Washington Post, where a headline reads, and I quote, "Troubled healthcare.gov unlikely to work fully by the end of November," end quote. For proof that this website design has been a failure of leadership, compare it to Cyber Monday volume at Amazon.com going back even a year to 2012. According to Amazon.com's press release, it sold 27 million items on Cyber Monday, or 306 items per second. That's how the private economy, the private sector, has been able to process huge volumes of data and requests. And so you compare and contrast that with the rollout of Obamacare and healthcare.com. It is a stunning, stunning failure and an epic in terms of the just the inability of that whole program to function with any level of competence. It's clear that the technology exists to fix the website to handle high volumes, but as the President has said, the health care law is more than just a website. And Madam President, that's where most of us come down on this issue, that this is a flawed policy that's causing millions of Americans to lose the health care that they like. Most of us know someone who's had his or her health care canceled by Obamacare. And it's going to get worse. The Associated Press reports that at least 3.5 million people have received cancellation notices, and that number is expected to increase to tens of millions of people. As Americans and millions more are losing their plans, only thousands are signing up through Obamacare. Constituents are encouraged, Madam President. We've got people out there to visit. We have a website, republican.senate.gov/yourstory, to submit their stories about how this is impacting them personally, because the American people deserve to have their stories heard, and Americans deserve to have the President and congressional Democrats keep their promise. Madam President, we believe that what former President Clinton said yesterday is correct, and that is that the President Obama, should honor the commitment the federal government made to those people and let them keep what they've got. That's essentially where we are today. And I would simply ask rhetorically, what is the President, what is he going to do to address and to honor the promise that he made to the American people that they can keep what they have? Increasingly, you're seeing more and more people, and of course there are many of us on this side of the aisle who predicted this would happen a long time ago, but even now more and more Democrats who are realizing that this was an ill-conceived policy. I've maintained for a long time that it's built upon a faulty foundation, and therefore you cannot just fix a website or have an IT specialist come in and expect this thing to get better. This is a flawed policy. It's having profound, harmful impacts on the American people already. We believe many more to come into the future as this thing is fully implemented. And so the best thing that we could do for the American people is to minimize the impact and the harm, is to put off, suspend, delay, whatever you want to call it, the implementation of this. And frankly, the best thing that we could do in the long run is to move in a different direction, to pivot away from this failed policy and move us in a direction that actually does address some of the fundamental problems that we have in healthcare in this country today. And I think, frankly, there's a whole list of solutions that Republicans have advanced and been for in the past, for example, allowing people to buy insurance across state lines, create interstate competition so that you have insurance companies competing with each other. Obviously, when you've got competition, when you've got the forces of the market at work there, it helps bring costs, bring prices down. Allowing small businesses to join larger groups to get the benefit of group purchasing power, to pool, if you will. That's something that we've been proposing for some time and has consistently been defeated by Democrats here in Congress. Reducing the cost of defensive medicine by doing away with the ending the junk lawsuits that clog up our legal system and drive up the cost of health care in this country. Allowing an expanded use of health savings accounts and those types of vehicles that are out there for people today to put money aside for their health care needs. Allowing people to have a refundable tax credit, that they can buy their own insurance, giving them more choices, creating more competition, and again, putting downward pressure on the cost and the price of health care in this country. Those are common sense, step-by-step solutions, Madam President, that we think would work so much better than having 1/6 of our entire economy, which is what healthcare represents, taken over by the federal government. Whenever you have political control of 1/6 of the American economy, you've got a command and control in Washington, D.C. that is driving decision-making across this country. And as we've already seen, the federal government does not do complicated tasks very well. And the federal government doesn't do comprehensive very well. Everybody talked about a comprehensive solution to this problem. Well, clearly we have problems in America today that need to be addressed. We have a lot of people who don't have health care. That needs to be fixed. We have people with pre-existing conditions. That needs to be addressed. But there are solutions to those problems that don't include and don't entail having the federal government literally take over 1/6 of the American economy, which is what happened with Obamacare. And we're seeing the impacts and the results of that today, Madam President. So I would suggest that we take a time out, that we make a decision, a conscious decision to move in a different direction, a direction that will lead to lower costs for people in this country, higher quality of care, allow people to keep the plan that they like if they like it, allow people to keep the doctor that they like, and keep the cost of health care at an affordable level. One thing we've seen since the Obamacare has been passed and now in the process of being implemented is the promise, too, that people would see their health care costs go down, not up. That promise is another broken promise, because what we're seeing in America today is canceled policies, and as people try to get new policies, increase costs. We're seeing that in the individual marketplace. The president, when he was campaigning for his health care law, said that he would drive the cost down for families by $2,500 per family, and yet we have seen the cost per family increase since he took office by $2,500. And we've got an effect on our economy, a cloud hanging over our economy right now because of this massive new regulation, massive amount of government mandate and requirements that people offer government-approved insurance. We've redefined now the work week from a 40-hour work week to a 30-hour work week, and so we have a lot of employers who are creating not full-time jobs but part-time jobs. Employers are now, to avoid the mandates and the requirements and the costs associated with Obamacare, are hiring people to get under that 30-hour work week. And so you've got a lot of people now that are being hired at 29 hours a week. Well, you can't take care of a family you can't meet the needs that you have in your personal and family budget on 29 hours a week. So more and more people are having to get more than one job. In fact, many of the jobs that have been created this last year, by some estimates, a majority of jobs created this last year have been part-time jobs, not full-time jobs. That's the impact that this is having on the overall economy. And if we're serious about getting the economy growing and expanding again, creating jobs, good-paying jobs for middle-class Americans, there are a number of things that we can do to create that kind of economic growth. And what we've seen of late is a growth rate that hovers between 1% and 2%. It's lethargic. It's sluggish by comparison to any historic average. We continue to have chronic high unemployment. And if you factor in the fact that the labor participation force, it is at the lowest level, literally, in the last 35 years. You have to go back to the administration of President Carter to find a time when there were fewer people as a percentage working as a percentage of the entire workforce. You factor that in, and you've got an economy that's in a real bad way, Madam President. And there are, as I said, a whole series of things that need to be done to get the economy growing and expanding at a faster rate, creating more jobs, increasing the take-home pay for middle-class Americans. But it really starts with starting over, getting a do-over on Obamacare, moving in a direction that actually, Madam President, I would ask for an additional 1 minute unanimous consent.
Is there objection? Without objection.
I would suggest, Madam President, that it starts with shutting this down and starting over and creating more options, more choices, more competition in the healthcare economy in this country so that people can get away from the sticker shock that we've seen with Obamacare and get costs down, get away from these cancellation notices that are going out, allow people to keep the care that they have and that they like, and allow them to keep the doctor that they have and they like. All of which right now is not happening, and all of which are broken promises under Obamacare. So, Madam President, we can do better. We should do better for the American people. But until we decide that this was the wrong direction and pivot and go in a different direction, we're going to continue to see the results that we have today. Higher cost, more cancellations, people not being able to keep the care that they like or the doctor that they like. We can do better, and we should do better. Madam President, I yield the floor.